I'm here. I'm here with Donna Morgan from Heartland Medical. You're out of Oklahoma, right?
Yes.
And you, early on, you've treated hundreds and hundreds of patients with NeuroCare product. Tell me about one of your memorable cases early on.
Probably one of the most memorable was a young lady in a trach unit. And a trach unit simply means that these patients are on life support systems. They have such traumatic brain injuries that they are on complete life support. So they have, the quality of life with these people is minimal. This young lady happened to be diabetic, drawn into a complete fetal position. She had a pressure sore because of the ankles going together in this fetal position. And when Dr. Kinney called me and told me to take my NeuroCare machine down and treat this young lady, she was scheduled for surgery 2 weeks later.
To amputate the foot?
To amputate her leg above the knee.
Oh, wow.
It was already black just below the knee. Absolutely no circulation in that leg whatsoever. When Tom was talking today about the odor, when you remove that that there's a cap on a pressure sore, then the odor that comes out of that, but it's because the skin is basically dead. Okay? But believe it or not, we started treating this young lady, and because of the severity of this, we treated her 3 times a day. Now, I'd treat her at 6:30 in the morning because you can't start in Oklahoma before 6 a.m.
How long were the treatments?
45 minutes. We never do less than a 45-minute treatment.
And her leg is black from the toes up?
Up to the knee. And within 2 weeks, we had her leg as pink as mine or yours. And it just so happened that a couple of days later, there was a young lady sleeping in her room. And when I went in to treat early that morning, and I said, "Oh, I'm sorry." It was her daughter that was visiting her mother. And she said, "Oh, are you the lady that treats her leg?" And of course I said yes. And she said, "You don't know how wonderful it is from our standpoint that my mother, riding a motorcycle without a helmet, is where she is today with her boyfriend, and they had an automobile accident. But she did not lose that leg."
Was there anything else besides NeuroCare that you did?
No.
Was that the key to your treatment?
That's all we did.
3 times a day, 45 minutes a day. You saved that limb. No doubt about it.
No doubt about it.
Have you seen this repeated over and over again?
Oh, many times. Many times.
Thank you so much, Carol.
You're welcome.
Donna. Is there a Carol in your family somewhere?